have a great deal of sympathy for people who are suffering with allergies, with food allergies in particular. I've met many people with a variety of different allergies, ranging from quite minor ones, intolerances, to people who are very allergic to pretty much everything that they encounter. I know how difficult that is and the effect that has on somebody's life. I'd like to share a couple of things though that maybe give a little bit of a different perspective. The first is the concept that allergens are harmful. Allergens are not harmful. A peanut, for example, is not harmful. The body's response to that peanut is that it is a perceived threat, and therefore it brings about an immune response, and that is the harmful thing. That's what brings about an allergic reaction for somebody who has a peanut allergy, for example. So it's the body's response to that allergen that's the problem, not the allergen itself. There's an idea that allergies are not treatable. Actually, the person that has said that allergies are not treatable, what they're actually saying is that they don't know how to treat an allergy. And those are different things. Many things were untreatable before somebody learned how to work with them, how to treat them. Many illnesses were uncurable until somebody learned how to treat them. So rather than defining a condition as being untreatable, let's say that that way of thinking hasn't got an answer. So how are allergies formed? Well, let me give you one example of how an allergy might be formed. Suppose you're having dinner with your partner and it ends up in a big row. So that row causes you to feel quite bad, quite negative inside. Now if your body links the food that you're eating to that negative feeling, then that might be the beginning of a food allergy. Because your body is trying to protect you and it decides, that food is causing this bad feeling. I don't want that, so I'm going to fight against that food. That's a problem. That's a food allergy. Conversely, how do we let go of a food allergy? By associating a very good feeling with the food that you are allergic to or intolerant to. If you do that, that's the beginning of letting go of a food allergy. And it's possible, and it's safe, because all of it is done in the mind. There's no exposure to food whatsoever. It's all done using the power of the mind. So I've worked, for example, with a lady who came with multiple food allergies. Multiple. She was only able to have boiled rice, that was it. Also an allergy to nickel, I believe it was, one of the worst her dermatologist had ever seen. Her body had linked a very negative feeling with foods, and it began to generalize to many foods. It was trying to do its best, it was trying to help her, but it had made a mistake. And what we're doing is trying to re-educate, to reteach the immune system to do it better, to protect you better. So how do we treat an allergy? Using the most powerful tool we have. It's more powerful than any of the computers that has ever been invented, more powerful than the latest technology in any part of the world. And it's a tool that every single one of us has, but we don't use it. The human brain. Einstein says that we use just a fraction of the brain. And if we could use a little bit more, we would be able to do unbelievable things. The human brain is so powerful that every single drug that is ever tested needs to be tested against the power of the human brain before it is allowed to be sold on the market. So can the immune system be taught? Absolutely. In fact, it's learning every day. From when you were just a tiny baby every single day your immune system has learned, it's improved, it's developed. Just occasionally it might have made a mistake. That's the bit that we need to correct. That's the bit that we need to reteach, to re-educate. Think of a vaccine. What's a vaccine doing? It's teaching the immune system what to do. If you have a vaccine against chickenpox, it's teaching your immune system what to do when it comes across chickenpox. That's the whole point. In exactly the same way, using the power of the mind, you can teach your own body what to do when it comes across a food allergen. But of course, it won't be a food allergen anymore. It'll just be a peanut. Now clearly, we need to make sure that we're acting safely. Clearly we have to be responsible. And I always recommend that people get tested properly by a medically qualified professional before going out and eating what they were allergic to. But once you've done that, you're free to live your life again.